Hi all, I'm Dr. Rajat from SNS Physiotherapist and Assistant Professor at India. Today we are going to see about a lecture video series about stroke of cerebrovascular accident and its physiotherapeutic approach as well as the surgical approaches in the medical schools. We'll go to the class. First of all, we know that in previous classes I already said, stroke, it is a neurological deficit caused to by a focal vascular lesion in the brain. It may be because of the hemorrhagic, it may be because of the ischemic, or it may be because of the emboli. The blood vessels which is supplying to the brain is called as the circular villus. The group of vessels is called as which is supplying the brain is called as circular villus. This circular villus is having any hemorrhage or ischemic or emboli, vascular lesion in that it can't be able to give enough oxygen to the brain, so it leads to the stroke. From this, it may be ranges from mild or maybe to the more vigorous stages. In the mild, it won't affect it like it's one of the type like DIA. In namely the sensory motor, perceptual learning, emotional behaviors, and memory, intelligence, speech, and language function are all getting hurt in the stroke. See, in this picture, a single part of the brain has become a blackish lesion because it is not having enough supply of the oxygen. So, if the brain is not enough oxygen through the blood, then may lead to cell death, cell atrophy in the brain. If the cell becomes dead in the brain, it can't be able to supply the neurons, it can't be able to supply the electrical stimulus uh, to the path which is controlled by that particular part of the brain, then it leads to the hemiplegia or paralysis or a monoplegia paralysis or a diplegia, paralysis, or maybe a quadriplegia. It depends upon the place where the stroke is affected, where the blood vessels are getting affected. The incidence, it is uncommon below the age of 50, but in the type it is called as the young stroke will come up below the 30 or 40 years of people. It affects 1.5 times more than the females. The males are getting more affected than the females around 1.5 times because most of the men are smoking or alcoholic or having a very bad lifestyle or having a sedentary lifestyle. So it affects the males more. 80 to 85% of stroke are due to cerebral infarction because of the I already said the emboli like that. 15 to 20% are because of the hemorrhagic. The 80 to 85% of stroke is because of ischemic. It may be because of the emboli, which is started from the big vein thrombosis or any other plague or any other reason. It is. There are many risk factors like if a person is having hypertension, diabetes mellitus, hyperlipidemia in the liver, or cardiac complications, which is having any trauma to the brain, like a brain cerebrovascular, like head injury, and it was having, I already said that the person is having smoking problem, the person is having taking alcohol for so many years, if it is the person is having the family, if they do it because of the genetic, because of the plasma fibrinogen and overall numbers of less there. Many factors are inducing the stroke. Then, I already said there are three types of stroke. The first one is thrombotic stroke. Second one is the second thromboembolic stroke. The second one is the hemorrhagic stroke, and the third one is the transient ischemic. We will go through this types. In the thrombus, any thrombus from any other area, it can be coming from any other part of the body which attacks the cerebral artery, which blocks the cerebral artery, then there is no oxygen supply to the brain. Then it is in this picture, it is showing that the blood vessel is going. If the thrombus is blocked in this area, after that it is not going to the part of the brain. So in this picture, it's clearly showing it is becoming the stroke affected area of the brain. It is in thrombolytic stroke. Then the emboli. The emboli is the some other some other clot, some in some other area it is found and it comes to the part of the brain. So it is called as the emboli. If the brain is having a, uh, if the brain itself is having a clot, it is called as thrombus. The brain is getting a clot from another area, it is called as the embolic stroke. In the next part of the video, we will discuss the what are the other types of other types of the stroke, and we will discuss the other investigations, causes, and all. Thank you.